everybody, it's Dr. Ying Chi with OC Hand Surgery. Welcome back to another episode of In Good Hands with Dr. Chi. In today's episode, we'll be talking about a most common hand disorder, trigger finger. So what is trigger finger? Trigger finger is a type of tendinitis that's affecting the hands and fingers. Most commonly, patient will have pain and swelling over this area of the hand, and sometimes it's hard for them to grip. For example, they will have locking and clicking. Sometimes patient also feels like their fingers are catching, so they're not moving as smoothly. Occasionally, the finger will stuck in flexion, which would be like this. Sometimes the finger will stuck in extension. So this is all due to tendinitis. The common symptoms associated with trigger finger involves pain, swelling, locking and clicking of your fingers. Many times, patient also will feel a hard and painful nodule. Sometimes it's located right here at the base of the thumb if you have the thumb involvement, but many times it's mainly in this area. The reason you have a nodule here is because that is the tightest area for the tendon to pass through. It's called the A1 pulley. When the A1 pulley is thickened because of trigger finger inflammation, that's when you'll feel the tight nodule. Other symptoms will including locking and clicking, as I mentioned before. Multiple things can cause trigger finger. For example, the most common cause for trigger finger is overuse. If you're on your phones a lot, for example, you're weeding or doing a lot of gripping, playing golf, tennis, that can also cause overuse, therefore trigger finger. There are other reasons that's not related to overuse. They're usually related to patient's medical history. For example, patients with diabetes tend to have trigger finger quite a bit, and they tend to have trigger finger in multiple digits. Another cause for trigger finger can also be what medication you're taking. For example, for people who are on certain type of medication, they seem to cause trigger finger. Lastly, also some of my patients that's living with rheumatoid arthritis also seem to have trigger finger quite a bit. But the most common reason for trigger finger is overuse. How do you know if you have trigger finger and not other problems? Luckily, trigger finger symptoms are very specific. Usually it involves pain and swelling, again in this area. So this is called A1 pulley, or by the thumb. And the very characteristic finding is that patient will have locking and clicking of the fingers. The reason it is called a trigger finger is because when patient starting having the locking and clicking, when the tendon squeezes through the tunnel, when it releases, it feels like you let go of the trigger of the gun. So the findings are very, very specific, and it's a very interesting finding, very easy to diagnose. The treatment for trigger fingers including both surgical and non-surgical treatments, for which we're going to include in the next episode.